when they turn 40, 50, 60, 70, 80, they're still alive, they keep them alive, but their value or quality of life is
absolutely deteriorating. Okay.
You're telling me about a guy that fell off his bike that you treated. He was how old?
84-year-old.
84-year-old.
84-year-old gentleman out in California, retired minister.
Okay.
And he was riding his bike on a Sunday afternoon in a closed shopping mall. They were closed on Sunday afternoon, and he was riding his bike in and around the pillars, okay, of the awning. And he hit a patch of gravel and wiped out. Okay, landed on his shoulder, and that's how he ended up in my office. But here is an 84-year-old gentleman who's in my office because he wiped out while riding his 10-speed. Okay, I've got 30-year-old patients who I can't get off the couch.
Yes.
Okay, I mean, you know, the difference between an old car that's a classic and an old car that's a rusted piece of heap in a junkyard is how the owner took care of it along the way. You know, I've used the analogy that our bodies are like a brand new Lexus. Okay, it's a fine automobile.
Okay.
Okay, there are two ways you can destroy that vehicle. You can take that vehicle and you can drive it off the cliff and blow it up.
Sure.
Okay, and you've gone from a fine automobile to garbage all at once. Very few of us go that way. Okay, but we can't go that way.
Right, some do.
You can catastrophic injuries that make us that cause us to die.
Right.
Most of us destroy our Lexus not by driving it off the cliff, but by driving it to the Walmart. Okay, and we drive it to the Walmart, and the guy next to us gets out and opens his car door and puts a little dent in our fine Lexus. Okay, now we come out of the store and we see that little dent in our Lexus. Okay, we're going to come undone. Okay, first thing we're going to do is we're going to take that Lexus to the body shop. And we're going to say, fix it. I don't care what it costs. Fix it.
Mm-hmm.
Okay, because this guy opened his car door into my door, and he put a dent in it, and he chipped the paint. And if I don't fix it, I know that's going to cause me problems down the road. Now, it won't necessarily change the way the car drives, okay, but it will change the way it looks.
And expose an area and rust will get in.
Right, exactly. You compromise the integrity of those molecules, okay, the environmental influences get in, and that metal starts to break down. We call it rust.
Sure.
Okay, you know what you call rust in the human body? Arthritis.
Okay.
Okay, same basic principle. It's exposing the molecules to an unnatural or an inappropriate stress, and they start deteriorating and break down.
Suppose somebody has arthritis.
Mm-hmm.
This probably indicates a lifetime of not doing what?
Absolutely. Of not taking care of, not removing the little dents.
Okay.
You see, you put a dent in the car, you don't notice the dent. It doesn't change the way the car drives right away. But if every week you drove to the Walmart and somebody else put another dent in the car, at the end of the year you got 52 dents in that car.
Right.
Okay, and the first dent's starting to decay a little bit.
Yes.
Okay. You did that for a second year, now you have 104 dents in your car. Okay, now I don't know when, but sometime or another, all those dents are going to start influencing the way the car actually operates. Okay, it's going to start messing up its aerodynamics, the wind's going to start catching it, it's going to be harder to drive and manage the car. It's going to require more energy, okay, to keep the car going.
Okay.
Okay, well, we do that to our body. We get, you know, traumas when we're young, we get traumas as we grow, and we get traumas as we get older. Okay, but we never go in and take care of the traumas, or at least very rarely go in and take care of the traumas. We only take care of the traumas when it's a major crash. Okay, we don't take care of the little bitty dents. And it's the accumulation of little bitty dents that causes the car to deteriorate.
Which, the other day you said something about, they did a study on babies that were born, and during the birth process, like 80% of them?
Yeah, birth traumas are very common. Okay, first off, the way we give birth right now, okay, is
laying flat down on your back.
Laying on the back in the recumbent position. That process was started by Henry VIII.
Okay.
Okay, who had no concern about the health and well-being of the mother or the child.
Right.
Okay, he just wanted quick identification so he could decide what he was going to do.
Yeah.
Okay, but you know, giving birth laying on your back is very traumatic, not only on mother but also on baby. A whole lot more force, a whole lot more pushing has to be done in order to get that baby out of the birth canal. Those things are slippery and slimy for a reason. Okay,
yeah.
if we were in a stand-up or squatted position, okay, gravity would help those babies come out without so much force.
And most women in other countries use a birthing stool of some kind.
Use a birthing stool,
they're sitting.
You know, or they're sitting or squatting. Yeah. Absolutely. So birth traumas. Okay, you mentioned the European study. It was done by a researcher by the name of Gutman and his associate Fryman. Okay, and basically they evaluated 2,000 infants between the ages of 0 and 5 days old, newborns to 5 day old. And what they found is that 80% of those children were already showing signs of autonomic nervous system imbalance. Okay. Now the autonomic nervous system is our sympathetic and our parasympathetic nerves. Okay. Sympathetic nerves speed things up as a general rule. Fight, flight, get us out of the way of the falling right. Heart beats faster, lungs increase, blood flow to our muscles increase. Okay. Sympathetic nerves also tend to shut down the digestive tract. Okay, you don't care about digesting your White Castle, okay, when you're getting out of the way of the falling rock.
Right.
Okay. The parasympathetics have basically the opposite effect. They increase blood flow to the digestive tract, and they diminish blood flow to the heart and to the lungs and slow down their activities. Okay. Well, what Gutman was able to demonstrate is that 80% of the infants between the ages of 0 and 5 days old were already showing signs of an imbalance in those two systems. It would manifest itself in the forms of poor feeding patterns, ear infections, colic, general failure of the thrives, okay, temperature regulation problems, okay, all those sorts of manifestations. Found that the majority of those autonomic nervous system imbalances was a result of a distortion at the base of the skull in the atlas vertebra, the top vertebra right underneath the neck.
So during birth,
during the birthing process, and I've seen dozens of training films on
delivering babies.
Delivering babies.
Yeah.
And in normal text, okay, on a training film, they showed one doctor taking a baby's head and rotating it nearly 180 degrees, okay, as he tried to help that baby go through restitutions on the way out of the canal. What happens during the birthing process is the head and the body have to go through a series of corkscrew procedures, okay, in order to turn around and come down and out.
Right.
Okay. And unfortunately, our OB doctors tend to get a little bit anxious, okay, wanting to speed the process up.
It's money.
It's money.
Yeah.
Okay.
I can do 5 instead of 3 in a day.
Exactly. And so once that baby's head's out, okay, they don't want to wait for restitution. So what they tend to do is they tend to rotate that head real far to one side, okay, so that they can pop out the upper shoulder. Okay, and then they'll rotate the head real far the other way and pull up so they can pop out the bottom shoulder, and then the baby will come on out. Now, the baby has the ability to do that on its own if we just kind of back off and let it.
Right.
Okay, but no, we want to get it out as rapidly as we can. Okay, so like taking this young infant spine, okay, that has no experience in weight bearing whatsoever except for a little bit of in uterine, but it's floating in water there.
Sure.
Okay, and so you've got these young immature joints, okay, with this oversized head sitting on top of these undersized vertebra, okay, and you're taking it through extensive range of motion, okay, and it's getting stuck there, okay, and so they pull it out, and you know, this vertebra is twisted off to one side or the other, and it starts interfering not only with the nerve roots right there, but also interfering with the brainstem itself, okay. A lot of sudden infant death syndrome, crib death, okay, is linked to upper cervical spine trauma. Okay. Another major factor involved with that, and we'll talk about it in another lecture, is the vaccination issues which are associated with sudden infant death syndrome. But physically, the trauma of birth is very difficult on the baby. Okay, that's when it gets its first. If it's sitting in the uterus properly, okay, then it's getting its first trauma at the birth process.
Okay.
Now, just for the record, if the mother spine is distorted, particularly the pelvis and the sacrum, if it's distorted during her pregnancy, that causes a torsioning and a distortion to take place in the uterus, okay, and we end up with what's called in uterine constraint, okay, where the baby is unable to turn around and move in an appropriate manner inside the uterus, okay. And by the 7th month, the baby is supposed to be in a vertex position, head down,
right.
Okay. If it cannot flip over because the uterus is torted, okay, well then it ends up crammed into the uterus with its head being pushed down if it's in a true breech position.
Sure.
Okay, so we end up with babies with no necks virtually, okay,
right.
because everything's compressed down. If it's in a transverse line, okay, either a brow or breech or brow or facial presentation where it's laying crosswise in the uterus, well then we end up with a baby with an extensive hyperextension injury, okay, and that can cause problems. As a matter of fact, we know that cellular growth is 7 times greater in the in uterine fetus as opposed to the infant, okay,
after it's born.
After it's born.
Right.
Okay, so if you've got cellular activity taking place 7 times the normal rate of an infant, and it spends 3 months with its head compressed down like that, it's going to cause some morphogenic changes, okay, in the developing process of that spine. So that's why it's important for women during pregnancy to get their body properly taken care of.
Okay, so let me just try to summarize here, and we'll take a little break.